Hi, my name is Casey Walker. I'm an attorney with VA Disability Group. Today we're going to talk about chronic fatigue syndrome. We're going to cover the C&P examinations and what's relevant for chronic fatigue claims. We're going to look at the DBQ, which is the Disability Benefits Questionnaire, and we're going to look at exactly what examiners at C&P exams want to know and need to know in order to complete their reports. So let's dig right into it. We're going to turn to 38 CFR 4.88B as in boy, and this is going to be for infectious diseases. And you'll notice in this section, if you scroll down to diagnostic code 6354, that this is where we find the rating criteria for chronic fatigue syndrome. This section is what's needed in order to establish a chronic fatigue syndrome diagnosis for VA purposes. Without this meeting some of this criteria, you cannot have a diagnosis and be service connected with chronic fatigue syndrome for VA purposes. So there it states that you have to have new onset of debilitating fatigue severe enough to reduce daily activity to less than 50% of the usual level for at least 6 months. This has to be the exclusion by history, physical examination, laboratory tests of all other clinical conditions, which means it's a rule-out diagnosis. And you have to have 6 or more of the following, and it lists the different types of symptoms. Acute onset of the condition, low-grade fever, and you can read the rest of them. You have to have 6 of those. So what does this mean? It means that you have to have a reduction in your activity levels by about 50% is number one. Number two, there's no other condition that's attributable to your fatigue. Again, it's a rule-out diagnosis, so it's hard to get a diagnosis of chronic fatigue syndrome because examiners like to attribute it to other conditions. But as long as you've ruled out other conditions that could be attributable to your fatigue, that's step 2, rule out. And then step 3 is you have to have 6 or more of the 10 listed symptoms, and they're all listed there for you. So once you've covered that hurdle and you've established a diagnosis of chronic fatigue syndrome for VA disability compensation purposes, now we're going to look at how you receive compensation. So we're going to turn to 38 CFR 4.88B as in boy, and there you're going to go down to diagnostic code 6354 for chronic fatigue syndrome. You'll see the repeated use of the term incapacitation. At the 10, 20, 40, 60%, you see them used over and over and over again. What does that mean? It means that you have to have a medical provider who prescribes bed rest. So, I mean, it's not a common thing medical providers will prescribe, but they somehow in the record need to write requires bed rest. So that's a little tricky. But if you want to get a good evaluation for chronic fatigue syndrome, once you've covered the first hurdle, which is getting a diagnosis for VA purposes, once you get into the evaluation that you're hoping to receive, you need to demonstrate that you've had bed rest, period. You need to demonstrate you've had bed rest. The chances of a VA examiner checking a box or saying that you need bed rest aren't real good. They don't know you. They're not your treating provider. They're looking at you for a matter of 30 minutes to an hour. This is something you should have documented before you go in, that you're examining or your treating provider should somehow write in some type of note that you require bed rest for your incapacitating episodes of chronic fatigue. Do that. Do yourself a favor. If you're having severe chronic fatigue, get that documented. Make sure that the examiner has a copy of that bed rest prescription. Make sure you've sent it to the Evidence Intake Center or the Board of Veterans Appeals. And I would even hand carry a copy of that and hand it to the examiner who assesses you. And hopefully you've done enough by that juncture to document the severity of your chronic fatigue. So one other consideration when looking at chronic fatigue is when you look at 38 CFR 3.317, this is actually a Gulf War presumption. They get into the multi-unexplained illness, Gulf War illness. This is kind of this is a condition that's expressly listed under those presumptions. So if you get a diagnosis of chronic fatigue and you served in the Gulf War or Southwest Asia, you're going to get service connection, assuming the VA does their job right. So moving on from there, let's take a look at the DBQ, and you'll find the link to the DBQ in the description. When we walk through this DBQ, you're going to have the standard things that you usually see. You're going to have the evidence review, which is them just reciting the history they see of your chronic fatigue in section 1. You're going to have a diagnosis section. Now you'll notice in section 1 that you're going to have the note right above section 2 in section 1, and it gives you all of the exact regulatory language we looked at for how you obtain a diagnosis for VA purposes. It's right in the DBQ and the examination report. Moving on from there, you're going to have section 2, which is again your medical history, just them regurgitating what you tell them and what they see in your records. 2B is getting into continuous medication. Let's get to the important part. When you go down to section 3, you get into signs and symptoms. This is where they start checking things that they see a history of. Objective, fevers, maybe they can see lymph nodes that are inflamed, something that's objective, that they can actually visibly see. And if there's a history of sleep disturbances and so on that you see in 3A. And then in 3B, they get into cognitive impairment. And so these are all the types of symptoms you see with chronic fatigue are all over the place, which is why they give a lot of different types of symptoms. But when you get into section 3D, this is where you get right at the heart of the rating criteria. They get into symptoms that restrict daily activities to 50% or 50 to 75%. And in section 3E, do the veteran's symptoms due to chronic fatigue syndrome result in periods of incapacitation? So I covered this a few minutes ago. Incapacitation is critical. If they check no there, you're not getting a compensable evaluation, period. So you need them to check yes, and then they have to check how frequent you have those periods of incapacitation. So this 3E is singly probably the most important part of the entire DBQ other than the diagnosis. You have to have a diagnosis. But you need periods of incapacitation. And how's that defined? You need bed rest. Moving on from there, when you get into the diagnostic testing section, which is found in section 5, you don't really diagnostic test chronic fatigue syndrome. It's a rule-out diagnosis. So maybe they'll put your labs there showing that you don't have some type of systemic disease or other condition that would be attributable to the chronic fatigue. But it's not really something you affirmatively say. You don't point to a lab and say, see, I have it. It's right here. It's actually a lack of what you find in the diagnostic testing. And then lastly, section 6 on the functional impact section. What you're going to have here is where the examiner notes how it affects you in the workplace. You're too tired to go to work or whatever it might be. This can be helpful if you file the claim for individual unemployability, because the functional impact section gets to the heart of individual unemployability claims. Adjudicators and judges will go straight to this section when they're trying to determine whether they should award unemployability to a claimant. So that's the DBQ. Now let's cover some unique considerations that we haven't discussed yet. Hopefully the DBQ made sense. As you can see, it mimics closely the regulations. So the hardest part of a chronic fatigue syndrome diagnosis is actually obtaining the diagnosis. I would say that the denial rate's probably in the 90 to 95% range because they attribute the fatigue to other things, other etiologies. So getting the diagnosis is a hurdle. Once you've had the diagnosis, keep in mind that once you receive compensation, anti-pyramiding laws still have to be considered. So what I mean by that is if you're compensated for mental health, or you're compensated for hepatitis residuals, or some other condition that you're receiving service connection and compensation for, some of the symptoms attributable to your chronic fatigue might already be compensated elsewhere. The VA can't compensate those symptoms more than once. When this happens, it might be detrimental to your chronic fatigue syndrome evaluation or those other condition evaluations. So anti-pyramiding laws. As I mentioned already, incapacitation equals bed rest. Get a doctor's note. Do yourself a favor and get a doctor's note. Another consideration is if you've had cancer or some other type of systemic disease or infectious disease, one common secondary thing you might want to claim is chronic fatigue syndrome. So a lot of veterans will just claim lung cancer or they'll claim malaria. And when they go in for the exam, the examiner checks that they don't have active malaria or active cancer, that they're in remission, and you get 0% for it. But if you expressly claim secondary chronic fatigue syndrome, now they have to address it. And claim it secondary to your malaria, or claim it secondary to your history of cancer that you're service-connected with. Only claim it secondary to service-connected things, but claim it secondary to something that is attributable to chronic fatigue, and you will have a better chance of getting service connection for the chronic fatigue syndrome. We already mentioned that chronic fatigue syndrome is a presumption. It's at 38 CFR 3.317 A2II. And these are all the unique considerations I have at the moment for chronic fatigue syndrome. I hope you found this helpful. If you did, like and subscribe to the channel. Thanks for watching.